Joining me today is Dr. David Doward, Jacksonville Orthopedic Institute orthopedic surgeon. Thanks for being here.
Thank you very much for having me.
Well, one of the things, I've talked to a lot of the personnel here at the Jacksonville Orthopedic Institute and a lot of the physicians, and they're all active, and you're no different. You're very active yourself.
Yes. I play a lot of sports. My biggest sport is tennis, which I played from the age of 6.
Well, tell me a little bit about, first of all, where you grew up and when you started playing tennis and kind of how that led you.
Sure. Well, I grew up in St. Croix in the U.S. Virgin Islands, so really rough life with all the beach and sun.
Good weather?
Good weather. A good setup for playing tennis year-round. My father got me started playing tennis at about the age of 6, and I quickly fell in love with the sport and excelled in it, and at about the age of 11 got noticed by some scouts, and that led to me getting sponsored by Prince Rackets. I traveled a lot throughout the Caribbean playing tennis, ended up doing some training at Nick Bollettieri's Tennis Academy, and by the age of 16 became ranked number 1 in the Caribbean.
Wow, well, you were serious about it.
I was dead serious about it, loved it, went on to play it in college, Division I tennis, and it's played such a major part in my life that I've tried to incorporate my future career into it as well.
Well, I know that you had mentioned you weren't sure what you wanted to do. You know, I get a lot of different stories in talking with orthopedic surgeons. Some are inspired. Well, I knew at 6 I wanted to do it. Some late in life go back. And you graduated from college and were doing some tennis and things with that. And then tell us a little bit about what led you to go back to medical school.
Sure. I actually studied engineering in undergrad, and I think it was the engineering in conjunction with playing on the tennis team that started getting my mind along the lines of the mechanics and the biomechanics of it, and also being able to help people. After college, I had a short stint where I taught at the top junior tennis academy in Southern California, ADR Junior Tennis Academy, and from then on that kind of sparked my interest in staying within tennis, professional tennis, and that kind of jump-started my career into medicine.
Well, I know you mentioned you went to Lafayette and then you had to go back to Columbia to get a few more classes.
Correct, exactly. There were some postgraduate courses that I needed to take once I decided to commit to medicine, and I did that at Columbia for about a year and a half, and then went on to Cornell Medical School. Wow,
it's a great school, and I know you did your residency at Stanford, and I know that Stanford has a great tennis program.
Yeah, they did, and I spent a lot of time taking advantage of playing with the guys on the team there, so that was a great 4 years.
Well, tell me a little bit about now. You're involved with Davis Cup. I'm a big fan of tennis. I love watching Davis Cup, still love watching professional tennis. Tell us a little bit about what your involvement with that is.
Sure. I've been doing this for about 5 years now. I serve as the neutral doctor not only for the Davis Cup but for the Fed Cup. So I travel throughout the country.
When you say neutral doctor, you mean?
So each team comes with their own doctor. So I'm out at the court side, and depending on what happens, if a player gets injured, I need to go out there, assess, and determine whether or not they are viable to even have medical attention, and whether or not their injuries are severe enough to discontinue play.
Wow, that's awesome. So how often do you do this, and where does it take you?
It takes me throughout the entire United States. We have a Davis Cup coming up right now. It's going to be in Birmingham, Alabama. It's the U.S. against Germany. And the Fed Cup comes up, and that's going to be in Maui, Hawaii. So that's real rough traveling there. Yeah, I'm going to love that one. And we're playing against Switzerland out there. So I typically have, depending on how good the U.S. Does in the matches, there could be maybe 6 trips that I do a year covering that.
Well, and so you get the opportunity to meet these players?
Absolutely. I know a lot of them quite well.
Well, it's got to be great for you playing tennis and now getting into this field and then having an opportunity to meet these athletes.
It's the driving force for me to be able to combine something that I love with another area that I love. I think that's always an equation for success.
So some of the more common injuries that you encounter in tennis?
Sure, I see the infamous tennis elbow, which is lateral epicondylitis. And that's something that can occur from just not having the right equipment, such as having a grip that's too large, a racket grip that's too large for your hand, or poor technique, and that's when professional lessons plays a role, to problems with your shoulder, which are overuse injuries that can result in rotator cuff tears, or shoulder impingement, to problems with your back. Obviously, ground strokes require...
And as you get older, I can attest that begins to be more prevalent.
The bending and the explosive rotational forces that occur with the open stance, forehand and backhand, in addition to the hyperextension that occurs with serving, places a lot of stress on your back. And for the adolescents, that can lead to pars fractures. For the regular player, that can lead to loading of the facet joints, which can cause pain.
Well, tennis elbow, what would you recommend to someone that, A, how do you treat it, and is there anything you can do to help prevent it?
Sure. Tennis elbow, sometimes we do a little steroid injection. Sometimes we can do even something more sophisticated like a PRP injection, where we take a little bit of your blood and inject it. We centrifuge it down and inject it back into that spot. But more commonly, we do conservative treatment before we do that, where we are doing specific exercises to stretch your extensor tendons and strengthen the forearm muscles, in addition to using a supportive band at the extensor tendon insertion site to try to help relieve some of the pain and pressure there.
And how about, I guess, for the back, just general kind of preventive, what would you recommend?
The reason players can be predisposed to back injuries is all the quick movements that you have associated with tennis, but also a lot of players don't stretch properly, or they don't strengthen their core properly, and that can lead to a lot of problems.
Also, tell me a little bit about the most exciting Davis Cup match you ever witnessed, and while doing this. I mean, does one stand out?
Sure, it does. There was one with Andy Murray, and that took place in San Diego. I think that was 2 years ago. This is along the journey where he was finally, I think it was the same year he won Wimbledon.
Man, what a journey he had.
Yes. So that was exciting. I was cheering for the U.S., but it was also great to see him win that as well.
Definitely. Well, I know you mentioned you still play. Tell us a little bit about your involvement and your playing. And
sure, I try to keep up with it as much as I can. I play in local leagues here, usually our A League, and about 2 years ago we got to the sectional, so I'm still playing at a very competitive level. It's great exercise. I love it. I did a couple of charity events several years ago when I first got here with the Malawi Washington Kids Foundation. Tracy Austin came out, and every year there's some celebrity event that comes out, and I try to get involved with it.
Well, you've been in Jacksonville, you mentioned, for 10 years. I mean, this is a good place to be if you like tennis, enjoy being outdoors.
It certainly is.
So what advice would you give to someone just in general about trying to stay healthy and being able to to keep playing a sport they love for any length of time?
Sure. A fundamental component of being healthy is what you put into your body. So lots of greens. I have a very alkaline, put a lot of alkaline fluids into my body because we have very stressful lives, especially if you're playing a lot of sports. You build up a lot of acetic acid in your body. Very important to stretch before and after matches. I implement yoga as part of my wellness regimen, which has that great balance between flexibility and core strength, which is critical to staying healthy and optimal performance.
Well, I mean, you look good, so it's working for you. Yeah. Well, listen, I appreciate you being here today. I look forward to chatting with you again and giving us some update on tennis. And, of course, as always, I mean, if you're having any issues and want to stay in the game, we encourage you to visit the Jacksonville Orthopedic Institute. See Dr. David Doward. He will keep you in the game.